You're watching TVC Breakfast. Let's get to our next discussion now. Every 31st of January, the world commemorates Leprosy Day to advocate for the equal treatment of persons affected by the disease and to re-educate the public about leprosy. According to Nigeria's Center for Disease Control, leprosy remains a major public health concern, with over 3,500 people diagnosed with it every year, and about 25% of patients having some degree of disability despite achieving the elimination target of the World Health Organization of 1 case per 10,000 population in the year 2000. The theme for this year, United for Dignity, calls for unity in honoring the dignity of people who have experienced leprosy, as stigma and discrimination against persons and communities affected by leprosy in Nigeria are still really high. That's the crux of our discussion now. So joining me to discuss this is Dr. Folakemi Cole-Adeife, a consultant physician, dermatologist, venerologist from the Lagos State University Teaching Hospital. Nice to have you join me. Good morning.
Good morning. It's nice to be here.
Great. Now, when we talk about leprosy, make us understand basically the feeling that comes with leprosy. When you hear of leprosy, no, keep them, don't, that thing. Why do people have that feeling against the issue of leprosy?
Well, I would say that leprosy is an age-old disease, and there are biblical records about it. And of course, in the Bible, lepers were segregated from society because, yes, it is an infectious disease. So most people are afraid, and then because of the major complications of leprosy, which involve, ulceration of the hands and feet, and then ultimately amputation. So they become, they have auto amputation of limbs and fingers and toes, and destruction of the face, which is very disfiguring. Many people are very afraid of contracting leprosy. However, leprosy, even though it's an infectious disease, is not as infectious as we think it is.
Okay.
And about 95% of people are actually immune to leprosy. So the chances that you will get it...
95% of people are immune?
Yes.
Okay.
So it's just about 5% of people who have some tendency to develop leprosy because of some immune function, poor immune function, that can actually get the disease. So it's not as infectious as people think it is. And that's why we are advocating against the stigma, against the discrimination. Also, there has been so much advancement over the thousands of years from the Bible. And there's now very good curative treatment for leprosy. So people who have leprosy can be treated and cured with multi-drug therapy. So there really is no need to be so afraid or to discriminate against people that have leprosy.
All right, talk to us first from the perspective of saying 95% of people are immune to that. How are they immune? What is causing that immunity?
Well, there is what we call a cell-mediated immunity that we all have, right. T-cell mediated immunity. And what happens with leprosy is there is a little bit of dysfunction in that for people who are susceptible to it. This could be as a result of malnutrition. Usually leprosy is associated with poverty. So a lot of crowding, malnutrition, and all can actually, make that T-cell mediated immunity to be a bit deficient. And then there are some possible genetic factors as well, which are still being, researched and investigated.
That is to say, it is possible or likely that someone can inherit.
Yes, it's possible.
Okay.
If there is a genetic component to that immune deficiency. So yes, it's not something that anyone and everyone, if you sit next to someone, with a good distance, or a person with leprosy touches you, that you're going to get it immediately. The route of transmission is thought to be droplets, actually, respiratory droplets. So that's why people who are in close contact for long periods of time with people with leprosy, family members, people who sleep on the same bed, may be more at risk. But we even have cases many times where one person in the family has this, and every other person, doesn't seem to be manifesting the disease. However, that may be tricky because sometimes the incubation period for leprosy can be as long as 20 years.
Whoa.
So that's one reason why we still have it today, because it kind of lays low in the body, and then at some point in time, the person can begin to manifest the signs and the symptoms.
In that incubation period, if anyone goes for a test, is it possible to detect it?
Well, not really,
Okay.
until there's, symptoms or clinical evidence of the infection. And that's one of the reasons why the WHO now is advocating for, or has added to the guidelines, what we call chemoprophylaxis. That is a preventive treatment for close contacts of people who have been confirmed to have leprosy. And that is to prevent, if there is that long incubation period, if they're still incubating any possible infection, it can be cleared. And I think that is something that will help to get us closer to 0 cases, which is our aim, to have 0 cases, 0 discrimination, So
right.
that's one thing that really, really should be a game changer. Okay. People who are close contacts, to have that chemoprophylaxis to prevent future infection.
Okay, so talk to us about the early symptoms. You mentioned symptoms earlier on. What are the things one should look at to say, okay, the moment you begin to see these signs, these are early signs of leprosy?
So usually leprosy can present in different forms. And again, it presents, in the way it relates with the immune system of the person who has it. So in someone who has a relatively good immune system, it could present as just a single patch, like a pale or slightly lighter patch than the normal skin. Usually
close to a ringworm, kind of?
Maybe not like ringworm. It's usually a flat patch, slightly elevated, but it could be lighter than your normal skin. And usually it may be just 1 or 2 patches on the cooler parts of the body. So you could have it on the face, on the arms, or on the back. And it tends to be not, too itchy or anything like that. But what is noted is that you may not really feel sensation on that patch as much as, other parts of the body. And then sometimes it can affect the nerves. Leprosy affects the skin, the peripheral nerves, the mucus, the nasal mucosa, that's the nose and the mouth, and the eyes. It can also affect the testes. So a person could have infection of a nerve, and when that happens, you find the nerve becomes thickened and visible. Usually a nerve that you don't see, then you begin to see some rod-like nerve, usually maybe at the back of the ear or by the elbow. That's also something. Then for people who have poorer immune function, it can present in widespread rashes, like raised, like nodules, bumps on the skin, and can actually disfigure the face, and then also maybe bumps on the earlobes, what we call nodules on the earlobes, and it can make the face, have what we call leonine facies, like you look like a lion, so there are lots of wrinkles, and can also damage the nose. So it can affect, it can present in a variety of forms, and that's one of the reasons why sometimes it's not so clear as to the diagnosis, especially in the early stages when it's just a patch and people think, oh, it's maybe a fungal infection, as you said, and it's treated continuously and doesn't go away. We had a case recently of someone who had the nodules or the bumps on the face, and someone thought it was pimples and was treating her for pimples, whereas she was actually, when she came to the dermatology clinic at Luth, she was diagnosed with leprosy. So it can present in a variety of ways.
Do we have inoculations for this? Are there vaccines one can take against leprosy?
At this time, no. There are no vaccines. I think there's a lot of research being done to see if a vaccine can be created. Some people believe that the BCG vaccine, which we take for tuberculosis, has a little degree of immune protection, and that's because the bacteria that causes tuberculosis and the bacteria that causes leprosy are in the same category. They are both mycobacterium. So some people believe that there may be some benefit from the BCG vaccine, which we all take at birth. So, but there is actually no vaccine specifically for leprosy at this time. But a lot of research is going on to see whether that, can be
possible.
Yeah.
So
Created.
let's talk about the issue of care before we go into the stigma and the theme and commemoration and all of that. Now,
Right.
the point there is, we hear that there is cure for leprosy. So
Indeed.
talk to us from that window. In fact, knowing that there is cure, it means people should be rest assured that it's not a death sentence.
Precisely. So there has been a lot of improvement and advancement in treatment of leprosy. So sometime in the 80s, the multi-drug therapy, was started, and that really cuts down the cases of leprosy to almost, complete elimination. There are just a few countries now that still have cases. Nigeria is one of those countries. And the multi-drug therapy is very effective. Within a month of starting that therapy, a person with leprosy is no longer infectious. They can no longer transmit the infection to anyone. So it's very, very vital that it is recognized early and that treatment started as soon as possible. Furthermore, in Nigeria, the treatment is free. The treatment has been paid for by the federal government and several partner NGOs that, sponsor the control of leprosy in Nigeria. So once that diagnosis is made, a person can be referred to one of the centers for treatment, for free treatment. And the treatment, depending on the type of leprosy, can be either for 6 months or for 1 year. So one needs to take the medications for up to 6 months or for 1 year. So when you have the more severe kind of leprosy called lepromatous leprosy or multibacillary leprosy, the treatment spans over a year, the multi-drug therapy. When it's a paucibacillary that's not so severe, or in people who have better immune function, then the treatment is for 6 months. And once that treatment is completed, in most cases, there is cure. In a few cases, there may be resistance, probably if the person has not been, adherent with the medication. And when you don't take your medications as prescribed, there can be development of resistance. But for most cases, once that treatment is completed, then there is cure for leprosy. So it's not something that should ever be thought of as a death sentence.
A death sentence.
Yes.
It's good
anything.
to imagine. It's good to know that, because that should be able to make people feel that, well, anyone who has leprosy and you can just refer to the center and the person will be taken care of.
Exactly.
Now, the point there is, you said that the incubation period is not easily detected.
Yes.
So it means one cannot decide, well, I'm just going for a leprosy check.
Well, not really, though.
Okay.
As we do general health checks, it's also important that we do skin checks.
Okay.
We advise everyone to check their blood pressure, check their blood sugar, have a complete physical examination at least once in a year. And that physical examination can include a skin check. And if anyone ever notices any unusual rash or new rash on their skin, they should see a doctor. And of course, if that rash is persistent, they should try to ask for a dermatologist, a skin doctor, to be referred to a dermatologist for review of that skin condition. The challenge we have in Nigeria is most people do not present until it's late. And when people have any issue, they try self-medication, they try herbal medication,
Tubes.
they try tubes, they just go
Ointment.
go to the pharmacy and get anything and keep using that. And what we advise is, once you've used something for 1 or 2 weeks and it's not going away or it's not improving, please try and see a professional, a specialist, so that it can be checked out properly. And if it's anything that requires treatment, it can be treated early and not wait until it begins to linger for many, many years. And even when that diagnosis is made, because of the stigma, sometimes the patients run away or feel, oh, it's not my portion. So we need to constantly remind people that this is not something that you need to be so afraid of or feel that it's the end of everything. Once, like I've said, they start treatment, within a month, they are no longer infectious. And within a year, that's the end of it. So it's even better than some other illnesses that you have to be on the medications for life. So we advise people to come to the hospital, see a professional, see a specialist for any skin-related problem that doesn't seem to be going away.
You know, Nigerians, if they can still go out, then check the doctor later on.
Exactly.
You know, except it hits them and then they are bedridden or something. Otherwise, it's just the skin stuff.
So
I'll treat it later, you know.
Yes, that's very true. We just need to improve our health-seeking behavior and realize, like the proverb says, a stitch in time saves nine.
Saves nine.
So when you go early for a review, you actually spend less money and you have a better outcome than when you decide to go late.
And especially when treatment for leprosy is free
Exactly.
anywhere in the country, isn't it?
Yes.
Very good. So anyone should feel free to call Dr. Folakemi and tell her, there is someone here manifesting something that looks like leprosy. But
as long as there's no discrimination.
No, of course. Yeah.
This year the theme is United for Dignity. So we had a webinar yesterday which included all the stakeholders on leprosy, the doctors, the dermatologists, the public health physicians, even the health workers, even the patients. We had some of our patients on the call. And of course, the National TB, Borrelia Ulcer and Leprosy Control Program coordinators and focal persons. And we all agree that we need to work closer together to reduce the stigma, to increase case detection, to educate all health workers about how to recognize and diagnose leprosy. And we hope that in a few years, by 2030, we begin to have closer to 0 cases being detected, and of course 0 people being discriminated against. Those leper colonies and things are things of the past. You know, they served a purpose in the ancient time, but in this day and age they are no longer necessary, and we want to avoid, you know, getting to a stage where we go back to that kind of thing.
But we still have those colonies in parts of the country.
That's true.
So what do we do with them? What do we dismantle them and send everybody back to their homes?
Well, it depends. Some of those colonies have become communities and people have become comfortable living in them. What we are trying to educate people about is not to stigmatize. And the colonies usually were associated with people who have disabilities with leprosy. And, you know, when there are disabilities, people find it more difficult to integrate into regular society. So in a way, we cannot just dismantle that. But we must make people realize that people who are there, who have taken treatment, are no longer infectious to, you know. Unfortunately, they are living with those disabilities. And the aim of, you know, moving forward with leprosy care and control is to prevent people from getting to the stage where they have such disabilities. So we can't really change the past, but we can do everything we can to prevent those kind of things from occurring in the future. So people who have disabilities need to be treated with respect, with dignity, and as much as possible, if they can still have a means of livelihood, then we should try to encourage them and incorporate them into society. Where that is not possible due to severe disability, they should be cared for by the government and by, you know, well-meaning individuals, and not just, you know, be looked at as outcasts from the society.
Talk to us about, on a day like this, how best should the day like this be commemorated?
So the day, like we said, is United for Dignity. We realize that we really need to cut the stigma. The stigma is a major problem with leprosy, and we want people to remember that it's not even as infectious as we think it is. You are more likely to catch a fungal infection or something else than leprosy.
Than leprosy.
Yes, and people who do have this can get cured within a year. So it's not something that can, you know, destroy a person's life if diagnosed. And now, if people are concerned, maybe you have a close relative who has been diagnosed, there is what we call preventive treatment. So that preventive treatment will be given that will prevent any possible future infection with the disease. So it's a win for everyone. The advancements with leprosy care and control are really, really commendable. What we need is everyone to work together so that, of course, we can get to 0 cases in our lifetime. And also for people who have leprosy, to be able to be incorporated back into the society without any form of stigmatization, ostracization, or discrimination.
Are there cases where leprosy manifests like sore in the in the feet and hands or something, where it could even lead to amputation and so on.
Yes, so that is the
Talk
problem.
to us about that, aspect
When
of it.
people have leprosy, it can affect the peripheral nerves, that's the nerves and the extremities. And what happens is that they are unable to feel normal pain sensation. So a person who has that kind of presentation of leprosy can step on a nail or step on something sharp and not feel anything. And ultimately they begin to develop cuts and sores on their feet or their hands from bruises. The usual pain reflex that we have is missing. And when that's missing, we are not careful, the person is not careful. So that's how they develop ulcers, sores on the hands and feet, which ultimately can then lead to, the amputation of the fingers or some of the toes and all that. So it's because the nerves are involved and, there's a loss of pain sensation that occurs. So that is one of the, the complications of leprosy that we find not as common as it, there's other types, and because of a lot of more awareness, we don't see as many people like that, but there are still some cases of that. And
if we hope to achieve the close to or almost zero cases by 2030, what should we be doing right now? Because 2030 is just about eight years from now. What should we be doing? Because we need to be intentional to get that.
Exactly. So we need to just be a bit more aware. Like what we had yesterday, a webinar, educating people about how to diagnose leprosy. We find the challenges, many cases, even coming to the hospital, people are unable to diagnose it. So specialists need to educate health workers, pharmacies, nurses, doctors, and everyone involved on the basic, how to make a diagnosis of leprosy. And once that is done, know the right places to send these people to for immediate treatment and follow-up. There also needs to be a lot of counseling to remind people that this is not the end of your life and this is curable, so that they will continue with treatment. And also there's what we call contact tracing, where you go to the house of the person to check their family members and also probably give them a prophylactic or preventive treatment. So once that is done and we are all working together, gradually we will be able to achieve that almost zero cases.
All right, we have to leave you here now, and thank you for what you do, Dr. Folakemi Koladeife. Thanks for coming on the program.
Thank you for having me.
Thank you.
Yes.
Great.